Hello, welcome back to my YouTube channel. For those of you who are seeing this YouTube channel for the first time, I would like to introduce myself as Dr. Roja Rani with PhD in psychiatric nursing, mental health specialty, and previously I have done few videos regarding different types of mental illnesses and the nursing management part of it. And today we are going to discuss about somatoform disorders and nursing management of somatoform disorders. For those who haven't subscribed my channel, please do subscribe and share to others, as this would be helpful for them too. So let's just straight away go into the topic. We are going to discuss regarding somatoform disorders. So what are somatoform disorders? You would have already heard about some of dissociative disorders and conversion disorders, etc., etc. And the word somatoform disorders come under neurotic disorders. They are defined as a set of disorders where a person experiences bodily symptoms that cannot be accounted by for a medical or neurological diagnosis. If we understand this concept, it is easier to understand some of the subtypes which come under these somatoform disorders. So just let's have a glance at this. A set of psychological conditions where a person experiences bodily symptoms. Some signs and symptoms are present in this person, and these symptoms does not account for any medical or neurological diagnosis. So medically and neurologically they are fine, but still the person suffers with some of the body symptoms. These type of disorders are called as somatoform disorders, and under somatoform disorders we have different subtypes like somatization disorder, hypochondriasis, we have persistent somatoform pain disorder, we have somatoform autonomic dysfunctions. We are going to just go in brief regarding these types of somatoform disorders. First, we will somatization disorder. What is somatization disorder? It is a disorder which is characterized by chronic multiple somatic complaints in absence of physical disorder. You can see the definition here. Chronic multiple somatic complaints. So these chronic somatic complaints do occur in different locations. For example, if we say two, definitely will be from gastrointestinal, one related to sexual or reproductive, and the other neurological symptom. There is pain or complaint in 4 different sites. 2 from gastrointestinal, 1 from reproductive or sexual, and another from neurological. So these symptoms are vague, presented in dramatic, as well as they have, already I have mentioned, they have, apart from this, anxiety which is present from moderate to severe anxiety levels. So this I have already told, 4 different locations, 2 gastrointestinal, 1 sexual, and 1 neurological. Anxiety from moderate to severe. Inability to voluntarily control these symptoms. If they want, also they cannot control, as they are present in them persistently in spite of their efforts. And apart from that, we have other symptoms like dependency with demanding attention getting behaviors. Now before we used to say ASB, which means attention seeking behavior. So when we say ASB, attention seeking behavior, now this term is being changed to care. Attention is being changed to care seeking behavior, because nobody particularly does things to get attention, isn't it? So it means when they are projecting these symptoms, it means that they need care. And apart from this, we have secondary gain. Then along with the symptoms, there is a significant distress or impairment in social as well as occupational areas, and they have a fear or preoccupation with their body functioning, or misperceived that they are having some major illness. Next, they have doctor shopping. So usually we do shopping for buying some clothes or other utensils or equipments or whatever it is. But here in somatoform disorders, what happens is the person goes to one doctor, they try to complain about their signs and symptoms, what they're facing, but still then after ruling out they're not having any physical illnesses, doctor tries to advise them that they're not having any physical illness and gives treatment, but they are not satisfied. So they go to another doctor, they get all the tests done, and similarly doctor will rule out that they're not having any physical illnesses, but still they are not satisfied, they go to another doctor. This is called as doctor shopping, going from one doctor to another doctor in spite of repeatedly telling that they are not having any physical illness and all, they are not satisfied. Then apart from that, involvement of one or more body symptoms, and whenever we say they're suffering with some form of psychiatric disorder, we need to understand that under diagnostic criteria there will be definitely impairment in their social functioning, family relationships as well as occupational functioning. When they reach to this level only, they will be coming to psychiatric consultations or hospitals. So this is all about somatization disorder. Next we are looking at hypochondriasis. It is a disorder which is defined as persistent preoccupation with fear or belief of having serious disease in spite of repeated medical reassurance. Now, how does this differentiate? How is this different from that of somatization disorder? In somatization disorder, we have symptoms present in four areas. We said two gastrointestinal, one sexual or reproductive, and one neurological. Whereas in hypochondriasis, they are preoccupied and they have a lot of fear that they're suffering with serious illness in particular area for that matter. Maybe if a person has some headache, they might think that they're having some brain tumor. If there is some abdominal pain, maybe gastric ulcer is there, or bone tumor is present if they're having knee joint pains, etc., etc., like that. For a little pain or whatever it is, they think that they're suffering with serious disease. That is how they are preoccupied with, in spite of proof showing them they're not suffering. Maybe they go through, for headache they go through MRI, CT scans which says that everything is fine, but still they are preoccupied with belief that they are suffering with some brain tumors, etc., etc. That is how it is with hypochondrias, exaggerated self-concern with preoccupied fears. Next, coming to somatoform autonomic dysfunction. These disorder mainly we see some symptoms which are predominantly under autonomic control. For example, palpitations. Next, hiccups. Next, hyperventilation, irritable bowel syndrome, dysuria. All these are like autonomic dysfunction symptoms. Next, we have persistent somatoform pain disorder. Here, pain is main core feature here. This pain is also perceived as very severe, persistent pain without any physical basis. And this pain is severe enough that causes a disruption in their occupational as well as social impairment. They are more preoccupied with having pain. So these are different types of somatoform disorders. First one we said somatization disorder, next one is hypochondriasis, next one is somatoform autonomic dysfunction disorders, then we have persistent pain disorder. I hope you got the difference between all these conditions. Next, we'll look at the diagnosis part of it. So, before we could categorize a person under this somatoform disorder, we need to rule out if they're suffering with any physical illnesses or neurological illnesses by doing different blood tests and CT scans, MRIs, etc. We need to do all this, then come to a conclusion. Then we need to take complete patient history. What are different types of current psychological stressors, what they're having. Once the organic side part of it is ruled out, then we can confirm the diagnosis if that side is clear that they're suffering with somatoform disorders. Coming to treatment modalities, we have first drug therapy. Under this we give antidepressants because if they're having any depressive symptoms, we need to treat them with antidepressants. Apart from that, we can give benzodiazepines. These are drugs which reduce anxiety in person, as well as we have some tranquilizers which keep them mind calm. So among this, we can choose different types of drugs. I think if you just watch my previous videos, we have gone in detail regarding antidepressants in our video depression, as well as regarding benzodiazepines. We have seen in detail in some of the neurotic conditions like general anxiety disorder, OCDs, then phobias, etc., etc. In all those videos we have seen about benzodiazepines. Please go back and review those conditions as well. Next, coming to psychological treatment, we need to provide them supportive psychotherapy and relaxation therapy. Regarding supportive psychotherapy, maybe from the family members or friends, religious groups. Maybe we can ask them to ventilate themselves and teach them some meditations, relaxation techniques, and these, whatever we are just discussing now, they're all dealt very clearly in my previous videos, like in OCDs and neurotic conditions. All these neurotic conditions we have been repeatedly discussing, so please go through those videos. Coming to nursing interventions, as said, for diagnosis part of it, we need to do physical examination, diagnostic testings. If there is any underlying pathology, we need to rule out first. So after that, when we are gathering any history, we need to provide a safe environment, supportive environment to the person, so the person can ventilate themselves well to us. And we should focus on a person as a whole, including psychological, social, as well as family factors, in addition to the physical complaints, whatever they're providing. And it must be remembered that they are not consciously trying to take this role that they are very sick and that they really want to avoid their responsibilities. But all these conditions, dissociative disorders or conversion disorders or somatoform disorders, they are done unconsciously because of the stress and the anxiety which is present in them. Subconscious mind and unconscious mind, whatever is present, this is projected outwards and they don't do it consciously. That we need to understand. Then respond to the patient with understanding and patience. Identify the types of primary and secondary gain. Now this also I have explained very clearly in conversion disorders. What is primary gain and what is secondary gain. Now, as we know that they show these symptoms unconsciously, but the underlying, because of the underlying anxiety behind which they are not aware of, or the stress behind which they are not aware of, produces these signs and symptoms. But once we treat them, we show them some attention, we try to get out what they are struggling with, and provide some support, psychological support to them, they get relieved of their anxiety or stress. That is called as primary gain. Next, secondary gain is, as a result of this stress and anxiety, the roles or the responsibilities what they are currently taken care of will be avoided for certain amount of period, where the person gets rest because they are under the treatment. That is called as secondary gain. So minimize time and attention given to the physical symptoms by providing different types of diversional activities and involving the patient in some types of recreational activities. Encourage the patient to keep diary of daily happenings as well as feelings along with the physical symptoms, so that we can identify the triggering events, when they're actually having these symptoms, before which incident, or when these symptoms have got triggered. All this we can just have an idea, we can have a look at if they keep the diary. Encourage the patient to make decisions and take responsibility for situations related to them. Then help the patient to identify more effective coping mechanisms rather than somatic complaints. So regarding coping mechanisms also, there are different types of coping mechanisms, where we say emotionally focused coping will be there present in the person, and problem focused coping will be there. In problem focused coping, we try to attack the problem, confront the problem, and we try to overcome the problem. That is how it is, coping mechanism. Then another way is like emotionally we try to adjust ourselves, settle ourselves, and try to get out of that stress area. That is how it is. Next, coming, this is all regarding some of the nursing management. Next, there are two other conditions which not two, we have another three more conditions we will just see in detail. One is neurasthenia. When we say neurasthenia, it is like persistent increased fatigue which is present in the person, where the person says, I don't have any energy, extreme form of tiredness, persisting distressing complaint of increased fatigue after mental or physical effort. Maybe the amount of effort which they put in might be very less, but they complain of extreme tiredness. That condition is called as neurasthenia. For simple works, I am very tired, that is their complaint. Next, coming to depersonalization, it is depersonalization and derealization. These are two conditions which are to be discussed in dissociative disorders. But we haven't discussed. In depersonalization, it is characterized by an alteration in perception or experience of self. They have a feeling that their own reality is temporarily changed or lost. For example, I will tell you. If you have gone to an area where people are flooded, or an area which was very lively and very busy till then, and suddenly some bomb blast occurs and the whole of that area scenario is, a complete scenario of that area is changed, where you see people with all full of injuries and losing their parts of body, bloodshed everywhere, and what will happen to you? You just imagine. That's where you go into a shock and you feel as if though this is not real. Am I really here? Is this the real place? That's how these sorts of feelings do come. So this type of feeling is called as depersonalization. It is characterized by alteration in the perception or experience of self, so that the feeling of one's own reality is temporarily changed or lost. So we feel, am I real? Or the environment around me is real? Like that. So these are two terms which we use, like depersonalization and derealization. Next, we have another condition like DART syndrome. In this, what happens is usually this syndrome is seen in Indian subcontinental areas. So the person feels as if though they are passing white discharge in their urine. Along with this, they have multiple somatic complaints, mental exhaustion, anxiety, depression, and sexual dysfunction also. So the treatment for these also is like supportive psychotherapy, counseling, and antidepressants. Now, for somatoform disorders, most of these disorders, they do not require any hospitalization. That's the reason, because they are less severe form of mental disorders. Most of them are treated in OPDs, community clinics, where they approach psychiatrists, and they are ruled out for any physical illnesses, and after ruling out that there are no physical illnesses, and when once we identify that they are suffering with anxiety disorders, then they are prescribed with benzodiazepine, antidepressants. They were given some advice on meditation and relaxation, and some coping mechanisms and problem solving mechanisms, how they can reduce their anxiety and all, and they're sent back home. So for these persons, usually they're given an appointment to return back for follow up, and during that time we need to teach the patient regarding adhering to the medications prescribed by the doctor and some of the side effects, and we need to advise persons on their regular exercises, eating habits, having enough rest and sleep, reducing or limiting their alcohol consumption and caffeine, because caffeine increases their heart rate, and alcohol also increases their stress levels, even though it relieves them temporarily. So we need to advise the patient on all these aspects, also educate them on their relaxation and meditation. So this is a small topic, but a very important topic. This exam in exams, a question can be asked on hypochondriasis or somatization disorders, but you should be able to differentiate. Uh, this is all about the topic. Before I could close this topic, I would like to summarize this topic. Like we have discussed on somatoform disorders, and somatoform disorders are the disorders where person complains about physical complaints, but where there is no obvious any physical illness or neurological illness which is ruled out before diagnosing them as somatoform disorders. We have discussed about somatization disorder, hypochondriasis, as well as somatoform autonomic disorder and persistent pain disorder as well. So I hope you have understood this topic. We'll meet soon with another condition. So until then, bye. If you haven't subscribed, don't forget to subscribe my channel and share to others. Thank you all very much.